Hello.
Special guest in the building, we have Dr. Curt Ahern.
Thanks for having me, guys.
Welcome.
Appreciate it. Thank you. Thanks, Emily. Thanks, Mo.
Thanks for taking time out of your busy day to do this for us.
Oh, wonderful.
Yeah.
Wonderful.
Curt here is our resident chiropractor.
Yeah, so, we're in the Jackson area, but the reason she mentions that is because we've been on site with you guys a few times over the years, adjusted many of you, and we're just having a good time.
It was amazing. So my first month here, Curt was on site, and I was amazed just how many facilities that this dealership offers, and one of them was a chiropractic adjustment.
Yeah.
Obviously, we're in front of a computer, we're looking down on our phones, and you adjusted me, and oh my
Just
lord,
lights went on.
Lights went up. I
We're
woke
spoiled
up.
here.
Yes, exactly.
It's like, oh, the chiropractor's coming in today. We're like, oh, okay, great.
And you just got an award for top salesman.
Yes, I did.
So
Thank
I'm
you
sure
so
we
much.
I think that helped.
You're welcome.
Yeah.
Yes.
Absolutely.
I might need to use you again.
I think we can work something out.
Was that your first time getting adjusted?
No, I actually been adjusted through Dr. John Smart, and he was using like a Polestar gun, but the way Curt does it, he adjusts me like a glow stick. I was like, please crack me like it, and he uses his hand, so it gets nice and deep in there. So sure.
Stay tuned for the end. I think we might have
I think we have a
little
surprise for y'all.
live on-air action.
Legit live.
Yeah, so thanks for joining us. A couple questions for you. How did you first get into being a chiropractor? Was that something you had thought about, or someone you had like a mentor that led you into it?
I kind of got into chiropractic when I was exploring my undergrad at Albion College.
Okay.
Graduated Albion in 2005, and then I started looking into chiropractic, and it was still new to me at the time, but my dad kind of turned me on to it. I had some issues at the time also that I was kind of working through with some balance issues and hearing issues, and a lot of ear infections still, even as an older individual. So once I started getting into that, it really kind of helped me out in that sense. And I went out to chiropractic college in Davenport, Iowa, and just never looked back.
Never looked back.
Yeah.
So chiropractic work, I don't know if that's the right way. Do you help with ear infections too?
Yeah, so I mean, we're definitely, working with the spine, and we see a lot of musculoskeletal issues like neck pain, back pain, headaches, but what a lot of people don't necessarily realize is that it's all connected. The spine protects the nerve system, so if there's a lot of tension and tightness up here, it can really inhibit the flow of drainage,
Okay.
down and out. So when you make those adjustments to the spine, especially like with kids a lot, it helps them out with ear infections because you're opening up that drainage mechanism.
Okay.
Yeah.
Nice.
So something to keep in
I
mind.
probably could use that when I was a kid.
Absolutely. I know I could, because I had a lot of ear infections.
Yeah, it's the worst.
Yeah, definitely not fun.
So when you were in school, you obviously said you had some health issues. Did you go to a chiropractor, and is that what motivated you to get into the career?
It did.
Okay.
Yeah, it kind of got me more interested in it.
Yeah.
And I started getting adjusted, and I was realizing that I was really getting some relief from it. So I really started to go all in. And then, like I said, I went to Palmer College in Davenport, Iowa. I did my my degree out there, and then I came back to Brooklyn, Michigan, and did some internships.
Oh, you were in Iowa?
I was.
I thought you said Ohio.
Did you say that? Ohio?
No, that's just what I heard.
Yeah.
Iowa, okay.
She needs to get adjusted,
Absolutely. Quad Cities, Davenport, Iowa.
Okay, nice.
For somebody who wants to get into the career that you're doing, what's the timeline from start to finish, like from after high school to get into being a chiropractor?
Yeah, so high school, and then I did 4 years of undergrad.
Okay.
And in most cases, you're looking at about 3 to 4 years.
So a bachelor's.
Yeah, essentially. Yep. And after that, you can get into the Doctor of Chiropractic program, and you're looking at about 4 years there also.
Okay.
So about 8 years total.
Yeah, 7.5 to 8 years.
Okay.
Yep. From start to finish. Yep.
That's good. That's good to know, because I feel like it'd be so intimidating to have someone's body in your hands.
Yeah,
I don't know.
manipulating.
It's so intimidating.
Right. It's definitely a trusting relationship that you want to have with that individual. Especially for the first time. I mean, coming and just not knowing maybe, or never having experienced the chiropractic adjustment, you want to make sure you're building that relationship for sure.
Yeah. So how was chiropractic school from a difficulty of 1 to 10? Obviously you guys are very hands-on. So what was the process like? Did they bring volunteers in for you guys to practice on, or how did that work?
We did a lot of. We beat ourselves up a lot. Working on each other over the years. But we did a lot of basic sciences, anatomy, cadavers, a lot of labs, dissections. Really to dig into the anatomy of the body, and then we had clinicals. So we did a lot of hours in clinicals as well, and just a lot went into other different things.
Yeah, because there's a lot of people out on the internet you're not a real doctor, but you still put 8 years after high school.
Right.
You still have to pass all your exams. You need to have a bachelor's degree, and ultimately you get your professional.
Yeah, I mean the hours that we put in comparatively to the medical profession are very similar.
Yeah, you said 8 years, and I'm thinking that sounds like.
Yeah, so I mean we take all the basic sciences just like any medical profession, any medical doctor out there. our hours in terms of bio and anatomy are actually more in some cases, because then they diverge into more of the pharmacology and the physiology, and we stay focused on the neurology aspect of things. So that's kind of that divergence at that point.
Oh, wow.
Yep.
Sounds like a lot.
Both are needed. Both are great
Yeah.
professions. We've used them in the past too, and we have a pediatrician, on board with our kids. If we need something, just different professions.
Yeah. So who would you say who benefits from going to a chiropractor?
Well, I think anyone with a spine.
Anyone with a spine.
I have one.
Everybody
Can really benefit. Really.
All ages.
Yeah, we see adults, we see kids, we see athletes. We see kids more for not necessarily back pain, neck pain, but for anxiety and migraines and digestive issues, because the spine protects the nerve system, and if the spine is out of alignment, it can affect the communication between the brain and the body and the environment. So we want to just make those adjustments and open up that pathway, keep it clear so that the body can heal and express itself and be as healthy as possible regardless of age.
Yeah, that's something that I think most people don't think about. It's not just like, oh, my back hurts, I have to go to the chiropractor.
Right.
It affects so much more in your whole body.
From sleep to just stress and breathing, digestion, and so many other things like you're saying.
Yeah, and I've seen like on TikTok, like little babies even can get.
Yeah, little babies get adjusted. Yeah, it's more of a lighter pressure. Little baby massage. Not necessarily as forceful, that we use when we adjust adults. But it's more like a pressure. But it's great for those kids that are struggling with some of those issues, sensory issues, ADD, ADHD type issues. Because again, it's about calming the nerve system.
Okay.
Because the birth process is very traumatic for mom and baby.
Oh yeah.
And when they get pulled out, it usually is traumatic in the sense that it twists the bones of the spine.
Oh my gosh.
And without those adjustments, it can affect the neurological function, and some of those other symptoms can manifest as a result of that injury.
I never thought of that. Yes. That is so crazy.
I was reading, does it help with babies who have what's called like colic? Is that what
colic? Acid reflux, abdominal issues, just a sense. What mom would say is more of they're experiencing uncomfortability.
Sure.
Gassiness or bloating. And so when we make those adjustments, we're able to kind of open up those areas and calm those kids down a little bit.
How do you know when it's time to come see you? Is it just like a regular checkup, or is it? How do you know? What are some like telltale signs?
Yeah, I mean, obviously you got the when people are in pain. People are hurting. And they typically then associate that with the chiropractic adjustments. Like, I need to go get adjusted because I hurt. But then there's other times, where you don't have pain, and people get adjusted just because they understand that, if my spine is in good alignment, my nerve system is going to be healthier. So they're getting adjusted, for wellness.
Right.
And they might not have pain, but they just want their bodies just to function optimally.
Right.
So.
Once you start going, do you now start going consistently as its basis, or is it a case by case?
The whole thing, like, once you go to chiropractic, you always got to go.
Okay. That's what they say.
That's what they say, right?
Yeah.
And you don't have to. Most people that experience chiropractic adjustments, continue out of it to some degree, because
it works.
Yeah, because they feel better. They function better, and they want to keep feeling their best.
Yeah.
That's the main thing. If people decide to continue out with that, then great. If not, cool. That's all right too. If they just have pain and want to get adjusted, we're there for them.
Yeah.
It's ultimately us just giving some recommendations on how to keep feeling their best, and then they can decide what they'd like to do.
Yeah. Well, if somebody is, for example, like with your teeth, right? You have to go see a dentist because otherwise tooth pain is one of the most unbearable pains.
Right.
But obviously, it's like, you want to, prevent a lot of future issues, right? Like sciatica or stuff like that. So it's always nice to go get your spine checked out, make sure everything's good.
Absolutely. You want to make sure everything's moving right, good motion in the spine, and the body's just going to function and be healthier as a result of that.
So I don't want to be hunched over.
No, we don't want that.
So.
I feel like my posture is always so bad. Like I'll catch my reflection. I'm like, oh my gosh, I look like a hunchback right now.
That conscious effort to kind of keep everything pulled back for sure.
Yeah, definitely.
Absolutely.
So, speaking of me,
Yeah.
What's the benefit of pregnant women going?
Yeah, great question. So a lot of times pregnant moms will experience the sciatica, the hip issues, the nauseousness, some of those things that come along with the pregnancy.
Yeah, I gotta really use that my first trimester with all the nausea.
So it can be a huge benefit just to keep the spine, the pelvis, and the sacrum in good alignment, so that if it's moving, well or optimally, not only are you feeling better, the mom is feeling better, but everything is better for baby as that baby makes that entryway. Rather than having those restrictions in the hips, things are moving well, so that baby can come through naturally, and there's less intervention, C-section or induction or all those types of issues that oftentimes moms don't want to find themselves in Just unfortunately, that's the way it goes sometimes. So there's interventions in terms of chiropractic that can prevent some of those things.
So do you find you have to like handle pregnant women differently and watch out for different things?
A little bit different technique.
Yeah.
You know, obviously they're not going to be lying on their stomach.
Right.
You know, at some point.
Right.
I mean, we can try and limit. So we can still adjust them on their side. In that type of technique position, and they can lie on their back, and we can adjust, you know, things up top in their neck, you know, for headaches or migraines if they're experiencing those through the pregnancy. Also, it's just, you know, changing the technique a little bit.
Yeah, because going through pregnancy is like everything's changing, your whole body's shifting, and
Moods, yeah.
yeah, oh gosh,
Absolutely.
yeah, physically and mentally. So.
For sure.
Okay.
Yeah, we can definitely make those accommodations for you.
Awesome. Yeah.
So obviously, parents like with kids, what's your opinion on them? Should they get checked out regularly as is basis? You know, when they're doing sports, just to prevent injuries, or
yeah, a lot of it is prevention, just to keep the kids moving and feeling good. Like you mentioned, you know, well, there's a lot of injury out there in sports and concussions and a lot of hits in sports. So, you know, those are all forces to the spine that if you can remove those areas of injury and make adjustments when they're much younger, you know, less chance of it becoming a bigger issue later on down the road for them.
Yeah. Is there a certain age that people should see you, or is it just?
So I mean, we've adjusted kids. I've adjusted kids as young as, you know, a couple hours old.
Wow.
A couple hours.
Yeah. So both our kids have been adjusted since birth.
Oh wow.
So I have a 9-year-old son and a 6-year-old little girl, and both have been adjusted within an hour old.
Oh my god.
You know, and so it's not necessarily, you know, an overpowering adjustment. It's more like a pressure that you would use, like on a ripened tomato.
Right.
And our one child was having some problems like latching, like breastfeeding.
Okay.
And so oftentimes that can be as a result of just the muscular tension in the neck. So it's uncomfortable to be in a particular position like that. So like when we made those adjustments, and it happens very often, is everything starts to move a little better. And then so those latch capabilities can then be restored, and they can start having, you know, equal opportunity to breastfeed in that sense.
Oh my
It's
gosh.
really cool to see that type.
How do you kind of isolate that? Like, is it just like with the sensation that you feel like in the spine, or?
Yeah, it's more of a feel, like a palpatory. You know,
Yeah.
we can feel where bones are restricted or not moving as much, and so those are areas that we want to key in on and focus the adjustment.
Yeah.
So that we can restore motion to those areas and allow that nerve function at that level of the spine to be restored and just function, you know, better in that sense.
I got you. So let's suppose like a new patient comes to your office, meets you for the first time. Like, hey, doctor, I just want you to assess me. What would be your process to do it?
Yeah, so we like to make the process real simple.
Yeah.
You know, I think chiropractic has become overcomplicated over the years, you know, just pages and pages of paperwork and, you know, exams. And I think let's figure out what's going on. They come in, we do a little bit of, you know, light case history review.
Yeah.
You know, they let me know what's going on. We'll assess that area of the spine. We'll take an x-ray of the spine to figure out the misalignments that might be taking place. We'll be able to see any arthritis or degeneration of the spine, and then we can do some work.
Right.
Typically the very same day. Like, people don't want to necessarily wait.
Yeah.
You know, if they're hurting, they want to get in, they want to get seen, they want to get help.
Right.
You know, so we don't want to necessarily prolong that process. You know, let's just get it done and get them moving.
Yeah, and one of the benefits in your industry, right, is like you get people off pills, right? Because people go to the doctor, it's like, this hurts. They're like, all right, cool, we'll prescribe you this. They only solve the symptom, but they don't get into the root cause of the problem. Like if your spine's out of alignment, they're not going to do that. They're just going to be like, all right, take this.
Just masking the issue rather than fixing it.
For sure. I mean, there's a lot of crutch work, you know, involved with medication at times. Of course, there's a time and a place for it, you know, absolutely. But many people, you know, they just become dependent on it. And like you said, Emily, I mean, it just doesn't necessarily get to the root cause of that issue. So with, you know, making adjustments and getting the body functioning better, many individuals are able to reduce or eliminate medications and be healthier as a result of that.
Naturally.
Absolutely. Absolutely.
Have you ever done chiropractic work on pets? Or has someone asked you to? Or what?
Is it real?
What are your thoughts on it? I've seen it again. I've seen it on TikTok. They have like the dogs,
crazy. Like,
and they crack the dog, and
I've
the
seen all the
dogs.
horse.
Yeah, there's horse adjustments. There's dog. I mean, I've adjusted, you know, I'm not gonna lie, like adjusted my dog.
You have?
Yeah. But
What's your message to people who are afraid to go see a chiropractor? Like they think, oh, well, if you adjust my neck, I can get a stroke or X, Y, and Z.
yeah, no, I mean, there's a lot involved when it comes to individuals' case histories. So we're always doing our due diligence to assess the situation. You know, it's one of the reasons why we like to take X-rays of the spine, so we're not going in blind. I mean, to see that misalignment is a great way of assessing what's going on, and then we can deliver that information to the individual and assure them that, yeah, we're in the right spot for this thing.
Got it.
You know.
Now, if somebody like younger, like myself, comes in and somebody older comes in, do you have a different technique of how you go about an adjustment?
Yeah, and so individuals such as yourself, I mean, we're going to be able to get in there and, you know, be a little bit more aggressive, so to speak.
Yeah.
You know, we don't necessarily have to hold back as much.
Sure.
If they're more of the infant, you know, we're going to be tailoring that technique. Pregnant mom, you know, we're going to be tailoring that technique, make them comfortable. As we get a little bit older, you know, we have some soft tissue techniques.
Yeah.
So yeah, we got a lot of different techniques to make it comfortable for
Yeah.
that individual, regardless of age.
Now, the snap, crackle, pop that you hear, is that actually the bone or like what's going on?
That's it's not necessarily bone. It's just gas escaping the joint space.
Oh, really?
Yeah,
Well,
all that is.
that's what intimidates me is the cracking.
Is the noise.
Or like whenever people even just crack their necks around me, I'm like,
Right.
"Ugh."
You kind of cringe a little bit.
Yeah.
Yeah, it's not necessarily bone on bone. It's just
Oh.
that pressure difference within the joint space that releases that popping mechanism.
Okay. Now, when you do an adjustment, you don't get a pop. Does that mean like it still went in, or does that really not make a difference?
Yeah, and you know, noise is not necessarily indicative of the effectiveness of the
Yeah.
adjustment. You know, obviously, we're gonna know. Like if it
Sure.
moves, it's gonna move, and if
Right.
it makes more noise, some people are just more noisy.
Right.
You know, so again, sound or noise doesn't necessarily mean it was like good or bad. But we're gonna make you feel it, right?
Right. Yeah. So, how long have you been in practice for?
I've been chiropractic 15 years.
15 years.
Yep, 15 years.
Now, so you've been doing this for a very long time. What kind of cases are you seeing now? Is it more of like the neck because everybody's at a computer, has their phone in front of them, or
down their
A lot of
phones
that, a
all
lot
the
of ones
time.
all day, you know.
yeah,
See
or
a lot
like
of
the lower
kids
back?
too, you know.
Yeah, what are you seeing?
They're gaming all day, you know, so kids, I mean, are hurt bad too.
Yeah, I
tight.
bet.
But we're seeing a lot of, you know, neck pain, back pain, you know, typical, you know, chiropractic things. But we're seeing a lot of stress, you know, anxieties. Again, with kids, sensory issues, you know, emotional issues.
So, stress can cause neck pain, back pain.
Yeah, it's kind of all tied in together.
Oh.
You know, so if you have, you know, subluxation as we call it, which is a misalignment on the spine, you know, let's say here, you know, it's going to create a lot of neuro tension,
Yeah.
muscular tension and tightness, which can just add to the whole, you know.
Right.
So we can get in there and open that area up and allow that thing to get freed up, and the body starts to respond.
Yeah, sometimes you don't realize you're tensed up until you
Right.
think about it.
Right.
I need to
Yeah,
loosen up my shoulders, take a deep breath,
for
and
sure.
go to chiropractor.
Now, for folks, I'm sure this has happened to everybody. Like you sleep wrong and you
Mhm.
have a pain in the neck. What are some home remedies somebody can do if you're not available or if it's a Sunday or something?
Yeah, I mean, there's some simple stretches out there. You know, we want to just keep motion in that area. So you know, any type of flexion, you know, extension exercises, lateral bend, you know, that individual could do at home.
Yeah.
Just to loosen up the musculature around that area will help free it up a little bit. We recommend ice most of the time just to kind of
yeah.
calm the inflammation on the joint. Heat has its place too, but heat oftentimes is more muscular, and it creates a lot of inflammation. So the ice can be a benefit because we want to, you know, calm that inflammation because it's more of a joint issue in many cases. So those are some of the things that people can do just to kind of get through that interim.
Yeah.
And then, you know, give us a call, we get you right in.
Right. There you go. Confirm or deny this, but does sitting on your wall and like throw your pelvis off or anything like that?
Yeah, I think it can cause some distortions
Okay.
within the pelvis and the hips, you know, so you know, I would avoid it, you know.
You avoid it, okay.
You know,
I feel like that's always men sit on their walkers in their back pocket.
yeah, you know.
Women don't have that problem. We're divorces,
Right.
so
But you see a lot of that too, like with the women. I mean, they're always
with
carrying
the
purses. Yeah,
purses.
exactly.
yeah,
And there are a lot of
that's right.
moms, you know, carrying their kids on one side. You know,
Yeah,
they're always getting, you know, torqued on one side. I mean, kids as they
Yeah.
get older and, you know, they become heavier.
that makes sense.
Yeah.
My purse weighs like 1,000,000 pounds. I'm like, I don't know what's in there. It's
Yeah.
just weird stuff.
All that mom
Ways
stuff.
yeah, all the mom
For
stuff.
sure.
That's
Yeah.
Yeah.
Is there a good like success story that you can share like with a patient, like somebody like that was dealing with like sciatica, could barely walk, and you doing the adjustment, like they have a normal life now?
Yeah, I think a lot of well, they're all great success stories, but the ones are life changing are the ones where like they're getting ready to have surgery. You know, like they've exhausted a lot of their other options.
And that's last resort, correct?
Yeah, typically, you know, not for everyone. Some people aren't just rushing right in, but for many, you know, they've tried other things. You know, they've done the needle injections or the pain pills, and they just haven't gotten the results. So, you know, they'll come in and then we look at that X-ray and it's, you know, bone on bone, and that disc is worn out. You know, that
Degenerate.
degenerative. You know, there's no cushion there. It's just biting down on that nerve. Maybe they got, you know, some herniations or disc bulges in that area. And then we come in and we make that adjustment, and then we can do some spinal decompression, open up that space, free up that opening. take the pressure off that nerve. You know, we've had individuals, you know, avoid surgeries. Like they
Oh,
wanted to go
really?
in there and fuse the entire spine. You know, a buddy of mine, his name's Chaz, and sticks to mine, and Moehn came in as a last resort. They wanted to fuse him from upper cervical all the way down, full rods and screws.
Yikes.
And they basically had 2 weeks before he was supposed to have the surgery. And I said, well, let's see what we can do. You know, we can't hurt him at this point. You know,
Yeah.
they've already wanted to do everything with him. So we got in there. I think we did like 4 or 5 adjustments, got things moving, and Moehn called off the surgery in like, 9 days.
Oh my god.
Yeah, so it was really cool to see, you know.
That's a great story.
Yeah, it's really awesome to see those
Yeah.
those success stories for sure.
Now, correct me if I'm wrong, but sometimes when people have these surgeries, it's not 100%, so it's not going wrong.
That's true. That's the case at times. There's surgeries out there that are very effective. You know, that they work well, and it's great for that individual. But there are other surgeries out there that are failed or they hold, but not for very long. You know, so we want to use surgery more as a last resort,
Yeah.
obviously.
for sure.
And so chiropractic can definitely offer one of those more non-invasive benefits
Yeah.
to not have to get to that point.
Yeah, and then you have complications too, right? God forbid if you do have a complication, then
Right.
surgery.
Complications, or they get locked up.
Yeah.
Typically, I mean, if you go in there and you fuse the spine, I mean, that area doesn't have motion anymore. So other areas of the spine have to overcompensate.
Right.
So they work harder than, like a car. I mean, you lock up one area of the vehicle, the
Yeah.
other areas has to pick up, and then that wears out faster.
Yeah.
So spine is no different.
Right. What would you say is like the most like painful injury somebody could have? Is it like TMJ? Is it sciatica? Is it just like neck pain?
From what I've seen, I've never had these issues.
Mhm.
I've had some low back issues.
Okay.
For sure, I've had some issues where I have some bursitis and my hip will lock up on me.
Mm.
But to really experience pain is the pain down the leg that just drops someone. Maybe just something just working in the yard, and it'll drop them and they can't move.
Oh my gosh.
Is that the
Yeah.
sciatica? Or the...
There's the sciatica, or a lower spinal issue where that disc is just worn out, and it's that last twist, or doing something just nothing really, and they turn or bend wrong, and then boom, puts them down.
Yikes.
Yeah, so a lot of the neurological, pains, facial pain too, like trigeminal neuralgia, which is like chronic face pain.
Yeah. So I want to ask you about a certain illness. It's called the suicide disease, I believe, with the pain in the face. It's in the TMJ, if I'm not mistaken.
Nerves, trigeminal neuralgia is basically excruciating facial pain. And it radiates, from the nerves in the spine into the face, and it can cause some really excruciating pain.
And they call it the suicide disease?
Yeah, and they describe that because it just gets to a point that it's so bad. People
my
just
gosh.
get,
Have you ever had somebody come in with that, or?
Not personally. I've had other individuals who have experienced that in other offices.
Yeah.
As described to me, and they respond well.
Oh, really?
With chiropractic.
Yeah.
Because if you can take pressure off the spine,
Yeah.
adjustment, and free up those nerves, you can calm those nerve irritations into that area,
Yeah.
and then they do really well.
I seen a video that they were actually putting the fingers in the mouth to move the bone. Is that another effective?
There's some other
technique?
techniques there
Okay.
to address the jaw issue.
Yeah.
For sure.
So we have a small request from you.
Yeah.
I haven't been adjusted in a long time, and folks who don't know the benefit or what it feels like, obviously, getting adjusted helps with migraines, aches, pains, all that. Can we do a live demonstration?
I think
Use
we-
me as a demo.
Let's crack them up. I'm on air.
Should we do that, Emily?
Yes, let's do it.
Yeah, we
Love
can
to
totally
watch.
do that. So I'll have you sit in my spot.
Let's do it.
Why don't we do that? We'll give these give this audience a show here, right?
Yeah.
And Mo's been adjusted before, so we
Yeah.
check
It's
this.
not his first rodeo.
No, not for sure.
All right, Doc. What's going on over here?
So we're gonna come right in here. We're gonna just check a couple areas of the spine. We're gonna be checking for, spinal tension, any misalignments of the spine, and then you can feel that tension right there. So we're gonna come in here. And essentially, your head's gonna be back like this, and I'll always try to explain to that individual kind of what we're doing, so there's no apprehension or anything like that. So in this case, the head's gonna be tipped like this. My contact is gonna be here, and then we're gonna make that adjustment like that. Okay. So just,
Ready.
He's ready for it. So just to kind of preface that, we'll bring you over, let that left ear fall a little more.
Ooh.
Down a little bit lower here too. Right over here, Mom.
Ooh,
Feel that?
I'm awake now.
Got that powder on for you. So
Yeah.
that's what we do. We make these adjustments, and it's all about
Wow.
just people moving the best we
Now,
can.
I feel like a weight is coming off. What's going on
Really?
here? Yeah.
You know, so a lot of times it's just that tension getting removed from the spine. Now, once you make that adjustment, things are able to start moving again.
So when you were assessing me,
Yeah.
what did you feel, and is there anything alarming?
No, I mean, there's things. Yeah.
How messed up is
How
Mo's
messed up
tongue?
is Mo?
Tell
Messed
us.
up Mo.
I mean, stop scrolling on TikTok.
Yeah, I gotta get you off TikTok. You know, I mean, there's areas of muscle spasm in the spine, there's restriction in the spine, so we want to do what we can to free that area up, so you get better range of motion. You know, improve circulation, improve blood flow, slow the degenerative process, and improve nerve function. Those are the main things that chiropractic adjustments help with.
I'm not saying this just happened, but like, I feel great. I feel loose.
Yeah.
Like, I feel great.
So
Yeah?
it's a good thing.
I'm ready to go sit in the car.
It's all coming for you.
There you go. Yeah,
You got it on your neck.
Sure.
Good little pop there.
I know, right? It's got crackle pop.
Yeah.
So, Doc, at the end of the podcast here, where can the people find you? How do they get a hold of you?
Yeah, thanks, Mo. So our office is located in Southwest Jackson,
Okay.
just down the street from Prime Cuts and
Oh,
White Steakhouse, right on the corner of Horton and Weatherwax. And we've been there for about 6, 7, 8 months now. We just sold our other office in Milford, so we're now full-time back in Jackson, 5 days
Amazing.
a week, yeah.
Yeah.
So our website is ahernfamilychiro.com, and if you want to give us a call, 517-795-1169.
Amazing.
Get you
Awesome.
right in.
We'll put that information in the description as well so people can find you.
Thanks, Em.
So, yeah.
Thank you, Dr. Curt Ahern, everybody. Thank you so much.
Guys,
Thanks for
appreciate
coming
it.
in.
Thank you.
Bye.